it's CJ. Welcome to week 13 of your pregnancy, which, depending on where you are, is either the last week of your first trimester or the first week of your second trimester. Today we're going to talk about what's happening with your tiny human, some of the symptoms that you can expect to be having in the 13th week of pregnancy. And if you stick around, I will tell you what you can anticipate happening if you have an OB visit scheduled for this week. At this point, your little one is now roughly the same size as a plum. He or she is measuring about 2.6 inches, that's 6.7 centimeters, from the top of their head to the bottom of their booty. That is what's called a crown rump length. And your baby weighs right around 2.6 ounces or 73 grams. This week, the bones are starting to get a little bit harder, especially in the head, the arms, and the legs. The heart rate has settled down and is now running somewhere between 120 to 160 beats per minute. And at this point, your baby is swallowing amniotic fluid and creating urine. The placenta has now taken over your pregnancy, and those hormone levels continue to come down. They don't go away overnight. They do decrease gradually, which is why you still don't feel perfect, but you should be feeling a little bit better than you were a month ago. The nausea, vomiting, breast tenderness, and fatigue have all been replaced. You are now having more cramps, twinges, round ligament pain. Every time you make a sudden movement, you get a pulling sensation down deep in your pelvis, and it can take your breath away. Unfortunately, that is perfectly normal. Your appetite has now returned, and those food aversions have turned into food cravings. You may be having more nasal congestion. That's because of the increased blood flow, as well as the progesterone being produced by your placenta. If you are having other symptoms, such as a fever, cough, or sore throat, that's probably not just pregnancy related. You might have a cold. And finally, it is very common for you to have a lot more heartburn. I recommend eating small, frequent meals throughout the day. Try chewing gum after you're done eating. And if all else fails, talk to your provider about getting medication to help with those symptoms. So what symptoms are not okay? Bright red bleeding that's enough to saturate a pad, cramping that won't go away, severe pain of any kind that is persistent. So if you have an OB visit scheduled for this week, here's what you can expect. They're going to get your vital signs. They're going to want to get your weight. It is absolutely fine if you haven't gained any weight just yet. Normally in the first trimester, between the nausea, vomiting, and the lack of appetite, most women don't gain any weight at all. They're going to want to review your lab results. If you had genetic testing done, you may even find out the gender of your baby. They're probably going to listen to the baby's heartbeat with a Doppler. Normal heart rate, like I said earlier, is 120 to 160 beats per minute. Most likely you will be scheduled for another visit in about 4 weeks. I do hope that you are writing down your questions in anticipation of your upcoming visit. In the meantime, if there are any questions that I can answer for you, I hope you'll leave those in the comment section below. And while you're in that comment section, I would also really appreciate it if you'd hit the like button or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.